Welcome. My name is Diane Jaselskis. I am the Total Joint Service Coordinator and Nurse Educator for the Joint Program. Thank you for taking the time today to prepare for your total joint replacement surgery. Thank you for choosing MaineHealth for your care team. We are all very fortunate to have so many excellent hospitals here in the state of Maine. However, research indicates when making the decision to have joint replacement surgery, you should choose a hospital and surgeon who performs the surgery often. As you can see, we do that each and every year. We did more than 2,500 total hip, knee, and shoulder procedures last year using state-of-the-art procedures that lead to faster recovery and lower readmissions. We do have many certifications, but the one we are most proud of is from the Joint Commission honoring our good work with a gold certification, which is the highest award for hip and knee surgeries, recognizing quality and patient safety. We are preparing for our fifth recertification. Goals for this online education session will include reviewing the steps for surgery to help you feel as prepared as possible for your upcoming surgery, and to provide answers to any outstanding questions you may have. Your surgical experience will involve an entire team of people. This team begins with you. We encourage you to invite a family member or friend to be your helper before and after surgery. Your surgeon and his team will assist you along the way in collaboration with the Joint Replacement Center staff, including nursing, care management, and therapy services. Your helper's role will be to act as your second set of eyes and ears both before and after surgery. They will provide you with encouragement and positive support during this time period. In preparation for surgery, please review the patient education folder you were given in the office. If you have not been provided one, please contact the office and we'll be happy to mail one to you, or you can access the information on our MaineHealth Joint Replacement Center patient education website. This packet is broken down into 3 sections: about your surgery, getting ready for your joint replacement, and after your surgery. You will also be mailed a copy of your surgical appointments, either through regular mail or your MyChart account. This will include pre- and post-op appointments. Please contact the surgeon's office if any of these dates and times need to be changed. Keep this copy in your folder as you will need to refer to it often. Also included in the folder will be a prep planner. You will use this for note-taking when you complete your anesthesia prep phone call. When you receive a phone call from the anesthesia prep department, which is a group of nurses who work within the anesthesia department, it typically is within a 30-day window to your surgery. The sooner you are able to clear through anesthesia, the less likely we are to have any delays getting you prepared for your surgery date. Have a paper and pencil ready. The call usually takes about 15 to 30 minutes. Bring a copy of your living will or advance directive to your history and physical pre-op appointment. They are important no matter if you're having surgery or not. We are not planning on using them. It's just good health care to have one and to have this family discussion. Bring to the hospital the day of surgery if you have not already turned it in. Mary Sexton Sands is an invaluable resource. She is a nurse care manager who will be available to assist in bridging the gap between the office and the hospital setting. She can be contacted to assist with any discharge planning needs and will collaborate with the hospital staff to ensure a safe and successful discharge plan. Your surgery will be authorized by MaineHealth prior to your surgery. You may want to call your insurance carrier to ask what your out-of-pocket expense may be for this surgery. The insurance code for a total knee arthroplasty is 447, and for a total hip arthroplasty, it is 27130. Keep doing what you're doing, but don't overdo. If instructed to do so by your surgeon, exercising before surgery will keep your muscles strong around your hip or knee joint. But if the exercises hurt, stop. Exercises can be found on our Joint Replacement Center website. Eating healthy, including protein in your diet, will help you heal. Staying hydrated with non-sugary drinks will also help with the healing process. Vaccinations should be kept 2 weeks away from your surgery date in case you have a reaction from the vaccination. Lastly, be informed, ask lots of questions, and share information you feel is important. Your participation in your surgical experience is vital for a healthy outcome. If you smoke, please take measures to stop. It will slow your healing, which we want to avoid. If you need assistance with quitting, please let us know so that we may help you. It is important that any chronic medical conditions are under control prior to surgery. If you have any concerns, please reach out to us so that we may assist you in getting you the help you need. Most of all of our patients are discharged to home after surgery. Please be sure you have the appropriate support set up to make this a success. It is wise to have a Plan A and Plan B regarding support at home after surgery. This is going to reduce your stress knowing that you have a great support system in place. Get your medical clearances done as soon as possible. Do those before your history and physical appointment if possible, and ask to have the results faxed to your surgeon's office right away. You most likely have had many weeks between the date of your first visit with your surgeon and the decision made until your history and physical appointment. Getting these appointments scheduled as soon as possible and completed will be helpful in getting you your clearances. Share any updates on medication changes prior to your surgery or any conditions that have changed. Follow orders for medications given at your history and physical pre-op appointment. These are typically around your pre-pain protocol, which may include Tylenol, Celebrex, and Lyrica. You'll be giving a prescription for each at your history and physical pre-op visit if this medication is right for you. If you need a prescription for a walker, your care team will provide one to you at your history and physical pre-op appointment. You will need to bring the front-wheeled rolling walker with you on the day of surgery when you arrive. This is the walker of choice, as it allows you to walk safely with good posture after surgery. The care team in the surgeon's office can provide you with prescription. Medicare typically covers one durable medical equipment every 5 years, so hold on to yours. You may borrow from a friend, a neighbor, or a relative. Make sure it's the correct height for you. They are adjustable, but do come in various sizes. Do not bring this type of walker to the hospital. It is too dangerous following hip and knee replacement surgery. A straight cane will be needed when you are no longer using the rolling walker. You will need a cane, but you do not need to bring this to the hospital. We have canes to loan while you are in the hospital for teaching purposes. Here are a few things you may want to consider when preparing your home as best as possible prior to surgery. Organize a living space with objects that are easy for you to reach without stretching up or stooping down. Practice walking with your walker through your home before surgery to identify obstacles. Remove the obstacles if you can. If not, share this information with the therapy team at the hospital or surgery center after your surgery. Set up a recovery area in your home that is comfortable and easy to access with your walker. Prepare meals in advance and stock up on non-perishable items if possible, and also line up care for your animals and pets as needed, especially to care for litter boxes in the first weeks following surgery. The night before surgery, you'll want to take a few minutes to review your paperwork and instructions that were provided to you from your care team. Remember to pack your photo ID, insurance card, and credit card for prescriptions if your surgery is scheduled at Maine Medical Center. Follow your instructions regarding showering with Hibiclens prior to surgery, and remember not to shave or use hair removal products. You do not need to mark the surgical area. Your surgical team will do that for you the day of surgery. Please remember nothing to eat after midnight. Stop clear liquids at the time you were directed to do so by the anesthesia prep call, which is typically 4 hours prior to surgery. These are important directions. Failure to follow these directions can delay and/or cancel your surgery. Also, take a moment to relax and try to get a good night's sleep. The day of surgery, please shower as directed by your surgeon's office with Hibiclens. Clear liquids only until the time you are directed to stop. You may take your medications as directed with a small sip of water. If your surgery is scheduled on the Maine Medical Center Bramhall campus, please do not bring any of your medications to the hospital unless you were specifically directed to do so by the prep anesthesia care team. If your surgery is scheduled on the Scarborough campus, please bring your regular home medications as directed to do so. There are a few items you should consider bringing with you the day of surgery. Your walker. If you have a CPAP or a BiPAP breathing machine, please bring it with you as instructed. Also, remember your insurance info, your photo ID, and a credit card for payment of post-op medications at the pharmacy upon discharge. Please bring personal toiletries, comfortable clothing, and sturdy shoes. The rooms may be hot or cold, so be prepared for anything. Please remember to bring a sweatshirt, short house coat, or anything that will help keep you warm. The facility will also have warmed blankets. Please ask if you need one. Watch the weather reports leading up to the surgery date. Surgeries are not canceled, so plan on traveling the day before if coming from a distance as needed. You will be asked to arrive 1 to 1.5 hours, 1.5 to 2 hours prior to your scheduled surgery time. The requested arrival time will be detailed in your paperwork. If your surgery is scheduled at the Maine Medical Center Bramhall campus, you will proceed to the main entrance where there is free valet parking. For those having surgery at the Scarborough Surgery Center, you will enter through the front entrance. There is no valet parking as the parking lot is close in proximity and located directly outside the building. Maine Medical Center Bramhall patients will be asked to check in with the admitting department, which is on the left, and then you will be escorted to the surgical area. Scarborough Surgery Center patients will check in at the front desk and then also be escorted to the surgical area. Included on this slide is a video link which you may watch for an overview of the Scarborough Surgery Center facility and the check-in process if you choose. Your helper may come with you the day of surgery and wait in the waiting area. After the admission process, you will enter into the Pre-Operative Care unit. Here, nursing staff will assist you in getting you ready for your surgery by starting an IV, taking your vital signs. You will also meet your anesthesia team and see your surgeon. The surgery itself will last approximately 1 to 3 hours. Please remember to let our staff know who to contact when your surgery has been completed. The phone call may display a blocked number or a spam call, so please be sure to make your helper aware so that they do not miss the call. Your anesthesia team will speak with you before surgery and discuss the best plan for you in the operating room. An adductor canal nerve block is done by the anesthesiology team and reduces the feeling and pain in the front of your knee after surgery. This is done for our total knee replacement patients only, and it is very effective in reducing your postoperative discomfort. Following your surgical procedure, you'll wake up in the recovery room. Typically, patients will remain in the recovery area for 1 to 3 hours. Please remember everyone recovers from anesthesia differently and times will vary. Also note that you will still have equipment hooked up to you to monitor your heart rate and your oxygen levels. You may have oxygen on to assist you as you wake up, and you'll have an IV for fluids and antibiotics, and although rare, you may have a catheter to drain your bladder. Once you have recovered from anesthesia sufficiently, you'll be transferred to your hospital room. Your nurse will be there to greet you. You may initially feel drowsy. You'll be encouraged to sip fluids and eat a light meal when you're feeling able. Even though you feel strong enough to get up alone, please ask for help by using your call bell. A nurse or therapist will work along with you to assist with your mobility, walking, and exercise instructions. Our goal after surgery is to make sure that your pain levels are tolerable. Remember, each and every patient will have a different level of pain tolerance. We will ask you to rate your pain using a 0 to 10 scale, where 0 is no pain and 10 is the worst you could imagine. We want you to set an acceptable goal based on that 0 to 10 scale. Many patients feel a 3 to 5 range is tolerable. We will refer to this scale frequently. Helping you manage your discomfort is important to us. Speak up and have a discussion with your nurse when your discomfort is not tolerable. Pain medications may make you feel weak, dizzy, or sick. Please make sure you do not take these medications on an empty stomach and make sure that you stay well hydrated. This will help in minimizing any side effects. When your pain is tolerable, you will be able to rest, do your exercises as directed, and ensure an easier recovery. Other comfort measures you may find beneficial along with pain medications are relaxation, deep breathing, distraction, and repositioning. We will encourage you to use cold therapy frequently with a maximum of 20 to 30 minutes on with at least 20 minutes off. Never apply cold to your bare skin. Elevation will also help reduce your discomfort by reducing swelling in your operative leg. Knee patients will take the CRYOCUFF device for cold therapy treatments home with them at discharge. Hip patients will be given a reusable ice bag for cold therapy. Please make sure you have ice available in your home. You may develop some swelling post-surgery, and we may instruct you to elevate your operative leg while lying down. You will do this by placing pillows under your entire leg while lying to gently raise your leg above the level of your heart. Please be sure to elevate straight. If you have concerns of swelling, please always feel free to call the office for further discussion and direction. Some patients may need to wear elastic compression stockings to help with circulation and prevent swelling after surgery. Your care team will provide these for you after surgery with instructions on when and how long to wear the stockings after surgery. The stockings are slippery on hard flooring, so please be sure to wear proper footwear to prevent falls. Side effects of narcotic opioid pain medications may include constipation and/or nausea. Constipation can be treated with over-the-counter medications and increasing fiber in your diet. Stay hydrated, please be sure to take your medications with food to reduce the chance of nausea occurring. If you are unable to easily resolve these symptoms, please contact the office for further guidance. We take risk prevention as a serious part of your surgical care, and you are a key partner in preventing complications. Walking helps prevent blood clots. Our goal is to get you out of bed as soon as it's safe after surgery. After surgery, the staff will walk with you using your walker to speed your recovery and prevent blood clots. Patients will also take a blood clot prevention medication after surgery as part of our recommendation for preventing the possibility of a blood clot. If you were previously taking any blood thinning medications prior to your surgery, as part of your daily routine, we would resume those medications as soon as safely possible. Prior to your surgery, you will be asked to wash with the antimicrobial antibacterial soap called HibaCleanse as part of our infection prevention protocol. You will also be administered preventative antibiotics during and after surgery. And of course, hand washing is key to prevent infections. Ag is the symbol for silver. Silver produces an antibacterial effect which reduces the opportunity of an infection. This dressing has fluid locking technology which helps wick away fluid from the skin and pulls it into the dressing. This dressing is intended to stay in place until your first post-operative follow-up appointment. If you notice fluid on the bandage that touches the sticky adhesive edge, please call the surgeon's office and discuss if the bandage may need to be changed. If your discharge instructions state that you may shower, this bandage is water resistant and will allow you to shower postoperatively just as long as the dressing remains sealed and does not appear to have any adhesive issues. You do not need to cover the bandage. Your surgeon, nurses, and therapy team will provide you with exercises to follow at home and to help promote a safe and successful recovery. They will assist you with reviewing your discharge plan in preparation for your departure home. Nursing and therapy will emphasize early walking as key to promoting healing and reducing complications. For Maine Medical Center Bramhall patients staying overnight, your therapist will post your therapy schedule in your room on the whiteboard, typically the evening of surgery, for the next morning prior to your discharge. Please remember to order meals around your therapy schedule when possible to avoid a cold meal. Those patients being discharged the same day as surgery, you will receive therapy instructions the day of surgery as part of your discharge instructions. Please invite your helper to join you to watch and listen while you receive instructions. We welcome and encourage their participation. Not all patients will need a visit from occupational therapy, but if you do, here are some of the tools they may offer you to assist you with getting dressed and bathing independently. Upon arriving to your room, your nurse will show you your call bell. Nursing and hospital staff want to provide you with the best care possible, so if you need something, we encourage you to please use your call bell and ask for help. Your nurse will also provide you with a detailed discharge plan, including instructions for therapy, follow-up care, and discharge medications. Your helper should be available to listen to these instructions with you if possible. When your surgery involves an overnight stay, a member from the care management team will help review your needs for discharge and begin to formulate a plan working with your entire care team. If you need visiting home therapies after discharge, the in-hospital care manager will help arrange these services for your home. Please come prepared to share the name of a home care agency you would like to use after surgery. For patients being discharged to home the same day as their procedure, your nurse will help addressing any needs to make sure your discharge is safe. Journaling or keeping a log of your daily activities, including your medications, will help you and your helper track your progress. Please be sure to have someone at home assist you. They will serve as an important role in your recovery. You may require assistance with light housekeeping, running errands, transportation to and from appointments. They may also be valuable to aid you with dressing, managing your medications, and reporting any health concerns to the surgeon's office. It is important to avoid going to the emergency room after surgery unless it is truly necessary. We want for you to be aware of who to call after surgery. Your surgeon's office is open Monday through Friday from 8 to 5 with on-call providers available on off hours and weekends. Please call the surgeon's office with any concerns of increased redness or drainage around your incision site, any dressing concerns, any severe pain that will not go away with rest, ice, and medications, a fever greater than 101 with any shaking with or without shaking chills, or shaking chills with a temperature that has not yet reached 101. If you develop a rash without any difficulty with breathing or swallowing, we would like to be updated. We would also want to be contacted if you have sustained a fall and you did not hit your head and you did not hurt your new joint replacement. The surgeon would still like to have an update. Plan ahead for pain medication refills and notify the office so that we may address those in a timely manner. You are also advised to call your primary care provider's office if you have an illness that's not related to your surgery, such as a sore throat, high blood pressure concerns, or sinus pain. If you are experiencing increased depression or anxiety or need a refill for your home medications that are routinely prescribed by their office, please call them. Always know that you should call 911 or report to your nearest emergency room if you develop difficulty breathing, shortness of breath, chest pains, a fall that included hitting your head or resulted in extreme pain, or a new rash that is associated with difficulty breathing or swallowing. Being well prepared is an important and vital step to a successful surgical experience. You are the most important person in your recovery. Having all of your questions answered will give you peace of mind and set you up for great results. We always encourage patients to come with a positive attitude and take an active role in your recovery. If you have any remaining questions following this online education program, please do not hesitate to follow up with us here at the office. We'd be more than happy to assist you. Thank you again for taking time out of your day to participate, and we look forward to caring for you.